Hi there, my name is Paterson. I'm the UCAN Research Nurse. I have a three-pronged approach to my role. Now, in the first instance, it's all about education and health promotion. Educating people in wider community groups, such as corporates, other organisations, on the early signs and symptoms of urological cancers, in the hope that we can save patients' lives and indeed catch these cancers at a much earlier stage to improve people's outcomes. The second approach to my role is clinical research. Now, this is research that's driven by patients and indeed is patient focused. Now, the results of this clinical research will indeed be filtered down through the care centre so that it will impact on the care and treatment that people get. And last but not least, the most pertinent thing that's most important that we want you to know about is the support systems that are available to people living in the northeast of Scotland. Now, we have a buddy system, which is a collection of patients who have already been through their cancer journey and are acting as mentors for patients who are newly diagnosed. Now, this could be in any type of form of communication. It could be an email, it could be a telephone, it could even perhaps be meeting up for a tea or coffee, anything that really suits best. Now, if you'd be interested in partaking within this type of support, either contact myself, Catherine, or indeed Kevin, or speak to any of the nurses on the ward or indeed any of the doctors. And the latest addition to the support that's available for patients in the northeast of Scotland is the Urology Web Forum. Now, this is a media whereby patients can go on and post anonymously comments or their stories, anything really, because it's their area, it's your area, what we're wanting you to do is to share information amongst each other. And certainly what we would find from the pilot run of the forum is that it's a media whereby patients not only use this as emotional support, but indeed an area where people can share practical information. But this leaflet here tells you all about it, and again, if you're interested in the buddy system or the forum, Kevin and myself's contact details are in the back of this leaflet, but indeed do ask any of the clinical team.
What I'm doing with the urology is that it was after I had my treatment, I got a phone call from Professor James Endow and said, would I be willing to help others who were going for a similar treatment as myself and act as a buddy type mentor person. And I said, oh, by all means, yeah, because I was quite versed in the subject and on the cancer itself and the treatments. I said I'd be most willing to help because I found that was something I missed when I was diagnosed for it. So that was the first I heard from him. And the next time I was invited to several meetings. And then they started getting involved in a forum. Now, a lot of people don't understand what a forum is, but it's something you use on the internet where you can actually ask questions anonymously, which is very important. Nobody knows who you are and what you do or where you're from. And they ask you questions, and people on the forum will answer these questions for you. So I said, yeah, well, I've used forums before in the past, and I'd be willing to participate. So I got onto I'm chairman of the Patients Advisory Committee, and I'm also the moderator of the forum. And it's quite exciting when you get people come in and they ask a question. You can sense the anxiety in the question, and you tend to help them as best you can and what information you know about that particular type of cancer. Unfortunately, I only know about my specific one and what the treatments are. But people, like write in and say, well, I've got a leaking problem. I've got to wear pads. Well, that does happen to certain people. And they write in and say, well, where do we get the pads from? And these are normal, run-of-the-mill questions. The patient understands, but sometimes the consultants and nurses are very good at diagnosing you, treating you, but it's the after part that you need to know all these little things. Oh, my stitches are weeping. I've got problems there. People will answer the questions on that. So I get involved in that and find it's quite interesting and very informative, because I've learned one hell of a lot about people, their attitudes, how they deal with the problems of cancer. So I think it's a good thing. And again, nobody really knows who's who. So if you've got a problem and you're shy and you can't speak, just put it on writing. And somebody will come back to you and answer your question. And nobody knows who's who and who you're writing to, which I find is very important. So I enjoy that. So that's how I got involved in what I refer to it as UCAN. It's a UCAN forum. And I hope it'll gradually get better and better. What I do find is because well, especially with the prostate cancer, which obviously I know a lot about, but we also cover, kidney, bladder, penile, testicle, various other cancers. It predominantly, it's like elderly people like myself who are affected. So what I tend to think is that not everybody in my age group is PC competent, so they're not used to using a computer or going on the internet. That's alien to them for a start. I'm fortunate I'm quite up to speed on that, but I feel sorry for others who can't, and it's sometimes difficult for them to use that type of media for gathering information. But the more they put into it, the more they get out, and that's all I can say on it. That's a bit the best advice I give to them. Be open, be honest, and speak about it.